Urinary tract infections, symptoms, causes, risk factors and diagnosis. Urinary tract infections, UTIs, are bacterial infections that can occur anywhere along the urinary tract, which includes the bladder, urethra, ureters, and kidneys. UTIs are a common condition that affects both men and women, but they are more common in women. Most UTIs are caused by bacteria, such as E. coli, that normally live in the digestive system. These bacteria can enter the urinary tract through the urethra and cause an infection. UTIs can cause uncomfortable symptoms such as pain or burning during urination, frequent urges to urinate, and cloudy or strong-smelling urine. While UTIs are usually not serious and can be treated with antibiotics, untreated UTIs can lead to complications such as kidney damage or a bloodstream infection. If you suspect you have a UTI, it is important to see a healthcare provider for diagnosis and treatment. Symptoms of UTIs. The symptoms of a urinary tract infection, UTI, can vary depending on which part of the urinary tract is infected. However, some common symptoms of UTIs include pain or burning during urination, increased frequency of urination, strong, persistent urge to urinate, blood in the urine, cloudy or foul-smelling urine, pain or pressure in the lower abdomen or back, fatigue or weakness, fever or chills, in more severe cases, nausea and vomiting, in more severe cases. It is important to note that not everyone with a UTI will experience all of these symptoms, and some people may have no symptoms at all. Additionally, some of these symptoms may be present in other conditions, so it is important to see a healthcare provider for an accurate diagnosis. Causes of UTIs. The most common cause of urinary tract infections, UTIs, is bacteria, usually Escherichia coli, E. coli, which is a type of bacteria that normally lives in the digestive system. However, other types of bacteria, such as Staphylococcus saprophyticus, can also cause UTIs. UTIs occur when bacteria enter the urinary tract through the urethra and multiply in the bladder or other parts of the urinary tract. The bacteria can then cause an infection, which can lead to inflammation and irritation of the urinary tract. Risk factors for UTIs. There are several risk factors that can increase the likelihood of developing urinary tract infections, UTIs. Some common risk factors include female gender. Women are more likely than men to develop UTIs, in part because of the shorter length of the female urethra, which makes it easier for bacteria to reach the bladder. Sexual activity. Sexual activity can introduce bacteria into the urinary tract, increasing the risk of infection. Use of certain types of birth control. Some types of birth control, such as diaphragms and spermicidal agents, can increase the risk of UTIs. Menopause. Changes in hormone levels during menopause can make the urinary tract more susceptible to infection. Urinary tract abnormalities. Structural abnormalities or blockages in the urinary tract can increase the risk of UTIs. Urinary catheterization. Use of a urinary catheter can increase the risk of UTIs. Diabetes. People with diabetes may be more susceptible to UTIs because of changes in the immune system and urinary tract. Weak immune system. A weakened immune system due to illness or certain medications can increase the risk of UTIs. Advanced age. Older adults may be more susceptible to UTIs due to changes in the urinary tract and immune system. History of UTIs. People who have had UTIs in the past are more likely to develop them again in the future. Pregnancy, which can put pressure on the bladder and urinary tract. Kidney stones or other urinary tract obstructions, which can block the flow of urine and increase the risk of infection. While some risk factors cannot be avoided, there are steps that can be taken to reduce the risk of developing UTIs. These include practicing good hygiene, staying hydrated, and urinating frequently to flush bacteria out of the urinary tract. Diagnosis of UTIs. To diagnose a urinary tract infection, UTI, a healthcare provider will typically ask about your symptoms and medical history, and perform a physical examination. They may also recommend one or more of the following tests. Urine analysis. This test involves analyzing a urine sample for the presence of bacteria, blood, and other substances that can indicate an infection. Urine culture. This test involves growing bacteria from a urine sample in a lab, which can help identify the specific type of bacteria causing the infection and determine the most effective treatment. Imaging tests. In some cases, imaging tests such as ultrasound, CT scan or MRI may be recommended to look for abnormalities or obstructions in the urinary tract. It is important to note that not all people with UTIs will have positive results on these tests, and some people may have UTI symptoms even if they don't have an infection. Therefore, it is important to see a healthcare provider for an accurate diagnosis and appropriate treatment.